Good morning, good afternoon, and good evening. Yeah, we are here joined for the South and Southeast Asia Climate and Health Responder course. Today is session 4. We are going to discuss about vector-borne and zoonotic diseases and climate change. So already you are aware about these our course objectives. So we want to enhance knowledge, confidence, and communication abilities of current and future health professionals concerning climate crisis. So we want to improve the population care and public health practice. Second, serve as a credible advocates within the institutions and communities and professional domains. And also the second one, equip interested current health professionals with the knowledge and skill needed to educate the institutions on learners so that health effects of climate change and emergency preparedness can be incorporated more easily into pre and post licensure training across the globe. Build and strengthen an agile and informed community around climate and health education, advocacy and policy for health professionals with strong mentorship and expert support. This is now that globally around the globe, and this of course has been doing and particularly targeting an South Asian population. So then you are aware about these sessions. So we finished already 3 sessions. We are here today for the 4th session, the May 28th, vector-borne and zoonotic diseases and climate change. So this particular session has no objectives, the session learning objectives that actually explain how environmental processes are changing as a result of climate change and how they impact the prevalence, incidence, and distribution of vector-borne disease. For the following diseases, describe how climate change is influencing their distribution. For dengue fever, chikungunya, Zika, malaria, effects of deforestation or bushfires or climate change, bringing forest habitat in closer proximity to humans. Explore what actions health professionals can take to identify and protect patients vulnerable to these diseases. Define steps the health sector can take to become prepared to address shifting geographic burdens of vector-borne diseases, including increasing surveillance and early warning systems and broader interdisciplinary coordinations. So I hope that you are able to understand our 4th session. Actually, this session has 90 minutes, includes the expert lectures and case study presentations, and sessions will culminate with question and answer section, and also enter your questions for the presenters in the Q&A. The session's video recordings, slide decks, and resources will be made available on the course website. So you could be able to make use of that. So that attendance, again, then we want to remind you, the attendance is automatically recorded during the live Zoom sessions. Your individual attendance is only counted if you join using your personal Zoom link. Your attendance is not counted if you join with a colleague's link. YouTube views will not count towards attendance. And these are, again, that for may be useful for the new participants. At least 7 out of 11 live Zoom sessions and pass the final exam with the score of above 70%. At the end of the course, will be awarded the certificate of participation in climate and health from the GCCHE. And on the final exam, the exam must be completed using the small email address using attended the Zoom sessions. The exam link will be sent on the final day of the class via email. So we have a 25 multiple choice and true-false questions format. So participants should be prepared to take the exam in one sitting. So today, for the fourth session, we got three eminent lecturers and to discuss about these the climate change and the vector issues. So we got Professor Dr. Shahanaz Chowdhury, the professor and head department of community medicine, faculty of public health at Bangladesh University of Health Sciences. And also we have Dr. Prabhat Adhikari, is an infectious disease and critical care specialist, CEO Center for American Medical Specialist, and Kathmandu, Nepal, founder and medical director at Novala Biotech Private Limited. And also we have Mr. Rajaram Pote's Shrestha, the National Professional Officer, World Health Organization, country office for Nepal. So I am inviting that Dr. Shahanaz Chowdhury, then he is currently working as professor at the head department community and community medicine, faculty of public health at Bangladesh University of Health Science, and she has started her academic career since 2000 with vast working experience in different organizations. She has gained both academic and administrative know-how during her work tenure. Dr. Shahanaz is a member, secretary of Ethical Review Committee, BUHS. She has been appointed as a director of operation, International Cooperation, Partnership and Research Center, and BUHS since April 2022. She has been working also as an adjunct faculty at Bangladesh University of Professionals in MBBS program since July 2022, and a tutor postgraduate diploma in Foundation of Global Health 1 and 2, Faculty of Health Medicine and Life Science, Maastricht University, Netherlands, and recently joined as a research fellow at INTI, International University, Malaysia. She has been recently appointed as a co-chair of the Competency Subcommittee of the Consortium of Universities for Global Health, and also the member of the Academic Partnership Program Initiative, APPI, of the Consortium University of Global Health. She played a pivotal role in the prevention of COVID-19 pandemic as a member of the subcommittee of the World Emergency COVID-19 Pandemic Ethics Committee. BUHS Ethics Institute. She was also the leader of the Disease Characterization Working Group, the Global Health Network, University of Oxford program. So, Professor Dr. Shahanaz Chowdhury recently received a Dr. Tom Hall Small Education Grant for her project on building global health capacity through a South-North tripartite institutional collaboration, LMICs, and developed nations for duration of 2 years. She participated in 5 days, 224 Summer Institute and Implementation Research for Global Health, focus on health equity, 18 to 24 July 2024 at University of Alabama, Birmingham, USA. She has 41 publications, first of the 7 and the national 5 and international 36. Improve the educational experience. He has worked on academic committees, developed curricula, and advised students in addition to her teaching duties. Her vast experience demonstrates a consistent commitment to promoting research and high-quality education field of public health. So today we are having her to deliver the speech as a first lecture. Professor Dr. Shahanaz Chowdhury, this is now over to you to start the lecture.
Can you hear me?
Yes,
Hello?
we can hear you. We can hear you.
Okay. Thank you so much for such an introduction. So I think I'm going to start my class. So here we are today to talk about vector-borne disease and how this climate change is affecting this. So what is really vector-borne disease? So this is illness transmitted to humans and animals by arthropod vectors like mosquito, ticks, and fleas. These vectors carry pathogens like bacteria, virus, and parasites that can be spread through bites. And this climate change alters critical environmental processes, influencing the prevalence, incidence, and distribution of vector-borne diseases. So the key climate-driven factors include temperature shifts, precipitation changes, extreme weather events, and sea level rise, which affect vector biology, pathogens, dynamics, human exposure. This exploration examines how these changes impact disease transmitted by vectors. So this is South and Southeast countries, as you know. So the learning objectives, you have already known that, so I'm going to skip that. So the key vector-borne diseases, I'm going to discuss today is about malaria, dengue fever, chikungunya, and Zika, and these are all mosquito-borne disease. So here, this bar diagram shows that is 2019 to 20 regarding the waterborne disease, respiratory disease, and vector-borne disease. Here we can understand that how these vector-borne diseases are also playing a part in this disease phenomenon. So here I'm showing this bar diagram regarding Bangladesh perspective. Here we can see that Dhaka is the capital city of Bangladesh, and Chowdhury is another large cities. And you can see that in Dhaka and Chowdhury, the cities, there are 34% of these vector-borne diseases. And you can see the national projection, urban and rural and all this. So it's happening in the monsoon season and also in the dry season. So regarding malaria, I'll be discussing about this now. So I just told you that malaria vectors that is spread through infected Anopheles mosquito, and the mosquito becomes infected after biting a person who already has a malaria. Then it spreads the Plasmodium parasite to the next person it bites. So there are 5 species of Plasmodium that infects humans. That is Plasmodium falciparum, which is the most dangerous kind. Then the Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi, which is the least common, but it's emerging. So this is a disease cycle of malaria, and we have 5 stages of that, how this mosquito, the malaria is transmitted. So the infection via mosquito bite, as we know that after an infected Anopheles mosquito bites a person and injects Plasmodium sporozoites into their blood. And the second stage starts in liver, and that is an incubation stage. The sporozoites travel to the liver, where they multiply silently for 7 to 30 days, depending on the parasite species. And here, no symptoms appear during this stage. And the third stage is blood stage. That is the symptomatic stage. The parasites leave the liver and enter red blood cells, where they multiply rapidly. As infected blood cell bursts, parasites spread to more red cells. This causes fever, chills, and other symptoms. And the cycles continues every 48 to 72 hours. Then come the fourth stage, that is the transmission to mosquito. Some parasites develop into gametocytes in the blood. When another mosquito bites this infected person, it picks up the gametocyte. And after that, when the fifth stage, infection in mosquito, inside the mosquito's gut, gametocytes fuse and form sporozoites again. These sporozoites migrate to the mosquito's salivary gland and ready to infect the next person it bites. So this is done in one snapshot, the malarial transmission cycle. And here we can see the chart showing from 1950 to 2020. We can see the country region-wise, and here the Southeast Asia region, how the malaria is projecting from 1950 to 2020. So what about the malaria burden in South Asia? So the prevalence, the WHO Southeast Asia region bears the second highest malaria burden globally. In 2023, there were approximately 263 million malarial cases worldwide, with the South and Southeast Asia region contributing significantly to this number. And regarding the mortality, the malaria deaths stood at estimated 597,000 in 2023. The South and Southeast Asia region has made notable progress in reducing mortality through intensified control measures. At-risk population, who are those? Over 80% of the 2.1 billion people are at risk of contracting malaria, underscoring the disease extensive research, according to Asian Development Bank. So there is a seasonal and geographic patterns. So the malaria transmission in South Asia is closely linked to the monsoon season. Increased rainfall creates breeding sites for mosquitoes, leading to higher transmission rates during the immediately after the monsoon. So the high transmission areas include northeastern India, states like Assam and Meghalaya, Bangladesh, particularly the Chittagong Hill tracts, Myanmar, especially the border region adjacent to India and Thailand, the Sri Lanka, coastal and forested regions, though the country has made significant strides towards elimination. So what about in malaria in Bangladesh? Bangladesh has made substantial progress in reducing malaria cases and deaths over the past few decades, with a notable decline in 2020. So here you can see that 2022 and 23, the malaria cases, and in 23, the malaria death has declined to 6. So that's the good news for us, for Bangladesh. So in malaria, the shifting malaria pattern is due to already concentrated in the specific areas, especially the Chittagong Hill tracts. And the climate change could potentially lead to shift in the geographic distribution of malaria risk, affecting areas previously considered low risk according to a report of World Health Organization. So the seasonal impacts is highly seasonal peaking during the monsoon season, that is May and October. Climate change could alter the timing and intensity of the monsoon season, potentially impacting malarial transmission patterns. WHO Global Technical Strategy for Malaria have started from 2016 to 2030. Here, the global targets by 2030 is that to reduce the malaria case incidence by at least 90%, reduce malaria mortality rate by at least 90%, eliminate malaria in at least 35 countries, prevent resurgence in malaria-free countries. WHO key WHO actions are leadership and coordination, research innovation, global guidance, that is to create and share ethical evidence-based guidelines for national programs, and monitoring trends, that is track and respond to global malaria patterns and threat. So as I told you that malaria in Bangladesh, the cases are being declining and the death case is also declining. So there is also a project going on that has been started from February 19. A small project is undergoing and they're giving vaccine and drug with a trial. And we are projecting that if this works out, maybe in Bangladesh, we are gunning for 0 malaria deaths by 2027. So regarding dengue fever. So dengue fever is also a mosquito-borne viral infection and causes a flu-like symptoms in severe cases, bleeding, shock, and even death. It is a major public health threat across Southeast Asia, especially in urban and semi-urban areas. The disease is mainly spread by Aedes aegypti mosquito. Secondary vector is Aedes albopictus. And these mosquitoes, they are the daytime biters, especially active in early morning and late afternoon. And they breed in clean, stagnant water, that is like flower pots, tire, tanks, open containers. And they thrive in urban environments and around the human dwellings. So this is a disease cycle, and this cycle has also the 4 steps. That is the mosquito that spreads into the virus. Mosquito then becomes infected and it has an incubation period of 8 to 12 days, and the transmission continues, and then the infection happens in the human, and this mosquito, when bites this infected human, and it transmits the disease to another human. So dengue burden in South Asia. In 2024, the region experienced a substantial increase in dengue cases. For instance, Indonesia reported 88,593 confirmed cases and 621 deaths by April 30, 2024, nearly tripling the figures from the same period in 2023, according to World Health Organization. A study estimated an annual average of 2.9 million dengue episodes and 5,906 deaths in 12 Southeast Asia countries, according to PLOS. In India alone, the annual national burden was estimated about 5.7 billion in 2026. So dengue fever poses a significant and escalating public health challenges in Southeast Asia. The region accounts for over half of the global dengue burden, with all countries except for Democratic People's Republic Korea reporting endemic transmission, according to WHO. So the high-risk countries in Asia are, according to WHO and CDC, that is Thailand, Indonesia, Philippines, Vietnam, Malaysia, Myanmar, Bangladesh, and India. So there was an outbreak in 2023. So that in 2023, outbreak was the deadliest on record in Bangladesh. That was 321,000 reported cases and 1,705 deaths, surpassing the cumulative deaths from 2000 to 2022. So the geographical spreading was Dhaka remained the epicenter, accounting for 110,008 cases and 980 deaths. And the outbreak extended to all the 64 districts with 211,171 cases and 725 deaths reported outside the capital. So approximately 60% of the cases were male and 56 were individuals under the age of 30 years. So here we can see how the reported case and death had been going on. So it's increasing, as we can see. So the case, according to 2023, it was 0.53% case fatality rate. So dengue fever in Bangladesh, you can see how the disease in 2019, 2021, 2022, and 23. So it's increasing day by day. So here up to till date, there were like dengue cases from January 1 to till date. It was the admitted cases were 3,704 and death was 23. And regarding the gender distribution, here we can see the male are more infected rather than the female. And regarding the deaths also, male are more dying, that is 56.5%. So divisional and city corporation death-wise, the death from 1st January to real death, we can see here, there are the districts like Barishal, Chattogram, Dhaka, and Khulna and Mymensingh. But in Dhaka city, we have 2 city corporation administrative unit. And here we can see the South City Corporation, they have more death than the other part of the countries. Here, monthly dengue cases by month, we can see the January, February, March, April, and May. We can see that even though we are saying that this is a monsoon season infected like dengue, but here we can see that in January, even though in Bangladesh it is changing, so now the cases is also seen during January, that is 1,161, and in May during this time, it's already dengue cases was projected 1,132. So now you can see that it's not anything like with the only we are going to say that it's related to the monsoon rain, but how this winter season is also having an impact on this vector-borne disease. This is an alarming situation for Bangladesh also. So the death is also, we can see till death, that in January there were 10 deaths, and in May up to that, and today it was 3 deaths. Now come to the chikungunya. So chikungunya is also a viral disease that is transmitted to humans by the infected mosquitoes. And here it is caused sudden fever, severe joint pain, muscle pain, headache, and fatigue and rash. So the chikungunya name came from African word meaning become contorted, referring to the stoop posture that is caused by intense joint pain. And the primary vectors are Aedes aegypti, common in urban areas, Aedes albopictus, found in rural and semi-urban areas. And these mosquitoes are the same as the found in dengue and Zika. And this is also, the disease cycle is also having 5 stages, and that is the mosquito bites an infected person, then mosquito incubates in the, virus incubates in the mosquito. That is, it takes about 2 to 10 days. And when a mosquito bites a healthy person, it infects a healthy person. And this incubates in the human, and it takes about, the incubation period is about 3 to 7 days. And here there is no symptoms. And when this mosquito bites this person and it infects another person, and the symptoms begins. So the burden in Southeast Asia, recurring outbreaks, since 2004, the Southeast Asia has experienced about 50 documented chikungunya outbreaks. And notably, in 2009, Southern Thailand reported approximately 22,000 cases within the first 5 months of the year. And surveillance systems often underreport cases, leading to an underestimation of the true disease burden. For instance, a study highlighted that during a chikungunya epidemic, excess mortality rates were significantly higher than reported deaths, emphasizing the need for improved surveillance. So there is a direct and indirect cause regarding this chikungunya disease. Chikungunya impose both direct cost medical expenses and indirect cost, that is loss of productivity. So how this chikungunya has spread to Asia? So from Africa to Asia from 1960 to 70s. So the Asian lineage of chikungunya was introduced into Southeast Asia during 1960s via international travel, trade, and infected vectors. And by 1970, the virus was endemic in India, Thailand, Myanmar, and surrounding countries. So from 2005 to 2006, Reunion Island outbreak, that was a global alert. A massive outbreak had happened in Reunion Island, that is in Indian Ocean, led to international attention. And the mutation was due to E1A226V in the virus, enabled it to adapt more effectively to a new mosquito vector, that is Aedes albopictus, which is more widespread than the Aedes aegypti. This adaptation helped the virus to spread rapidly through Southeast Asia, South Asia, and eventually Europe and the Americas. So here is the chikungunya in Bangladesh, the key statistics, that is the major outbreaks that has happened from 2010 and up to 2024. So here in 2010, no systematically reported, but in 2024, we have found that Zika, 55 confirmed cases, including 7 co-infections with dengue and Zika. And we can understand that it is notable that this is a re-emergence noted that is potential for larger outbreak in 2025. That is, it's a projection. So the chikungunya statistics in South and Southeast Asia, that is in India 2023, it was reported that 2,64,000, that is endemic across all states, significant outbreaks in Maharashtra and Telangana, and in 2024 continued to spread transmission to Pune, reported 462 confirmed cases, and in Pakistan 2024, that's 2,447 outbreaks, particularly in Karachi, and in Maldives, in 2019, there were 1,736 significant outbreak noted, and 2024 in Maldives, there were 389 elevated activity in multiple areas. In Thailand, we can see here, there were reported cases in 2008 and 10, there was no not applicable. And in Singapore, we can see that there were 13 cases in 2013, and 24 we could see that in 14 cases, and in Malaysia, it was in 2025, and there is no recent cases reported as far as reported. Now come for the Zika. So Zika is also a mosquito-borne flavivirus, closely related to dengue, yellow fever, and West Nile viruses. It is typically causes the mild illness, but it's most dangerous for pregnant women, as it can lead to birth defects like microcephaly that leads to abnormally small head and brain damage in babies. It was first identified in Uganda in 1947 in monkeys, and the first major outbreak in Yap Island, Micronesia in 2007. So the Zika virus is primarily spread by the day-biting Aedes mosquito, especially the Aedes aegypti that is in highly urban, most efficient vector. And the Aedes albopictus, it is seen in rural and forested regions. So we have the same kind of cycles in Zika virus. We have the 5 steps, that is mosquito bites the infected person, the virus develops in mosquito, and the mosquito bites another person. And here the virus incubation takes about 3 to 14 days. And then when the mosquito bites the person again, they have the symptoms appear, and that is the mild fever, rash, red eyes, joint pain, and headache. So here is the transmission mode. So the most important is the impact of Zika virus on pregnancy. As I've told you, that is the Zika virus infecting the pregnancy can lead to congenital Zika syndrome. And there can be also an asymptomatic infection, and that is the problem. The women do not understand or doesn't have the concept that the person is infected, and this results to fetal complication, making detection and prevention challenging. So here are the outbreaks of Zika infection in different Asian countries. And there is a possible emerging threat for Bangladesh as per the data says. So the possible action need to be adopted to prevent control Zika from Bangladesh is to have a knowledge, that is awareness on Zika and its transmission, zoonosis and control measures. And there has to be an adoption of surveillance system, laboratory facilities has to be developed, a serotype identification of prevailing serotype and genetic mutation of the virus in Bangladesh, effective collaboration, that is national, regional, international collaboration for combating the urgent situation, and definitely the vector control, that is unveil the biology of and transmission of viruses by the vector and the effective control measures. So this is a comparison table, and from this I have already as discussed before. So here we only have the malarial treatment, that is the antimalarial drugs, and we also have a vaccine related to this, but it's still on trial. And Ghana, Kenya, and they have this vaccine trial already. And due to this, the incidence rate has been declined. And in Bangladesh, as I have told you earlier, that there is a small research trial is going on in Chittagong. So we hope that this vaccine trial has a good result. And if there is, then we can give this vaccine and drug at the same time and have this incidence rate become 0. And we are projecting by 2027, Bangladesh will having 0 to malaria. So regarding dengue, yes, there is a vaccine available, and there is chikungunya. We do not have any vaccine. And there is also only for dengue, chikungunya, and Zika, we only have the supportive kind of treatment. So why this changing distribution, and what is the ecology of vector-borne diseases? So why this distribution? As I have told you, that this is due to the climate change, deforestation, and land use change regarding the urbanization and globalization and trade. So the past distribution, that dengue had been seen in the tropical cities, but now the current shift is regarding dengue, it is spreading to highlands like Nepal, Bhutan, and also in the rural areas. And the malaria, it was past distribution we had seen in forest and rural zones, but the current shift is expanding to urban areas via Anopheles stephensi. And regarding the Zika, we have seen the past distribution in Africa and South America, but now the current shift is more detected in Asia, Pacific, and Southeast Asia. So I'm going to elaborate a little bit about the climate influence. So the climate influence is regarding the vector-borne disease. It is due to the warmer temperature, because the faster mosquito breeding, it leads to faster mosquito breeding and quicker parasite development. And regarding on precipitation and humidity, it helps to increase breeding grounds, and forest degradation and climate-driven migration. It helps to bring the human closer to mosquito habitats. And regarding the urbanization and land use change, the unplanned urban growth leads to poor drainage, waste, and waterlogging. And this leads to the vector breeding sites and the bites, boosting the breeding sites. And sea level rise and coastal changes and disease-specific impacts, these are all leading to warming extends transmission seasons.
Shahanaz,
Yes.
please,
Yeah. Okay, I'll finish it. So as I have already stated this, I'm going to skip this. So regarding the warmer temperature, the temperature Aedes aegypti larvae mature faster, that is 28 to 32 degrees centigrade. So increasing the breeding rates. And the mosquito, Anopheles mosquito, it thrives in 20 to 30 degrees centigrade. So the breeding site availability due to the precipitation, increased rainfall creates the stagnant water for breeding. Like in South Asia, correlates with the dengue spikes. And the regional variability, I have already stated, so it is now projected into the highlands. And also, as I have shown you the bar, so it's not only the monsoon season now, we have seen the vector-borne disease is now transmitting during the winter season also. I already said that, so I think I'm going to speak this. So preparing the health sector for vector-borne disease. So here, regarding this, we need to strengthen the disease surveillance systems, implementing the early systems, strengthen the health infrastructures, emerging hotspots, train the health workers on emerging threats, promote interdisciplinary coordination, invest in research and innovation, and adopt the national health policies. So thank you so much.
Thank you, Professor Dr. Shahanaz Chowdhury. That a very excellent elaborated talk about that the present context of this vector-borne disease in this region, and also the challenges and things faced by to control. So the present scenario that. So now it's my pleasure to introduce our second speaker, Dr. Prabhat Adhikari. Is an infectious disease and critical care physician who has been practicing both Nepal and the USA. And also beside his clinical practice, Dr. Adhikari has been leading some research projects in Nepal, mostly in the field of infectious disease and ICU. Dr. Adhikari has also collaboratively established a multinational IT company called Dengue Health, where his team has developed a cloud-based EMR software that has been launched in Nepal, India, and beyond. As of now, Dr. Adhikari is collaborating with like-minded clinicians at Center for American Medical Specialist camps, where in the team is providing clinical laboratory research and academic services to several healthcare institutions in Nepal and abroad. During the COVID-19 pandemic, Dr. Adhikari and his team witnessed the horrifying crisis in the supply of medical services and equipment, ranging from medicines, vaccines to diagnostics. This led to the establishment of Novala Biotech Private Limited, wherein the team is dedicated to bringing in sophisticated technologies from around the world and addressing the existing problem in the supply of medical diagnostic in Nepal. So with this extensive experience of the health system and the supply chains and more especially towards the infectious disease, now that over to Dr. Prabhat Adhikari for you to deliver this second lecture. It will be limited to 20 minutes. Now over to you, Dr. Adhikari.
Thank you very much, Professor, for the introduction. So I think I'm here to present a case study about dengue or any other vector-borne disease with the example from Nepal. So I'm very glad that my previous speaker, she pretty much gave almost all the know-how to things about vector-borne disease, dengue, and all those things. So my lecture will be more focused on the practical aspect of application of the knowledge, So let me go over it. Do you see it?
Yes, we can see that. Visible. Please go ahead.
Okay. So I have a small disclosure. As mentioned earlier, I also work as a medical director for Novala Biotech, where we are focused on manufacturing or doing R&D for the point-of-care diagnostic kits for infectious disease and cancer. So in today's lecture, we'll be talking more about vectors and diseases, epidemiology with the changing dynamics of vector-borne disease, impact of climate change and environmental changes on VBDs, real-world initiatives and programs with focus from Nepal, and how healthcare professionals from different domains can take action in mitigating the problem, So let's talk about the vectors and disease. So I think it's been already spoken about. I'll just give a brief scenario of the diseases I'm going to talk about. So there are different kind of mosquitoes and there are different kind of vector-borne diseases that they carry, So today we are going to talk more about the mosquito-borne diseases, and we're going to talk more about the Aedes mosquito. And you can see the Aedes mosquito not only transmits dengue, but it also transmits other viruses like chikungunya, yellow fever, and Zika. And also there is another well-known mosquito called Anopheles mosquito, and that's responsible for transmitting malaria. So in today's lecture, we're going to talk more about the Aedes mosquito, dengue, and the things that Nepal has done to tackle the outbreaks. So a brief outlook about the dengue itself. So dengue is a virus disease, and it's transmitted by the Aedes mosquitoes. There are two different types of Aedes mosquito. And, so you can, if you want to go for detail, then you can actually go for the differentiation of the mosquitoes, but I think that's not important right now. So the take-home message from this lecture is that there's a mosquito, Aedes mosquito, and that's responsible for dengue and other viral diseases. So in Nepal, we have a big outbreak of dengue, and we also have scrub typhus. So I'm going to talk more about these two in this lecture. So this is a slide about the dengue virus infection in Nepal. We have data in this research article. There's data from 2006 to 2019. And on the left-hand side, you can see that the dengue outbreak kind of diagnosis started somewhere to 2010 and then kind of slowed down. Maybe nobody thought about it, or maybe it wasn't there. And then a major outbreak actually happened from 16-17 and a bigger one in 2019, And if you look at the heat map in 2016 to 2019, in 2016, it was more on the southern side. So if you had been to Nepal, or if you know about Nepal, Nepal has almost three types of altitude. On the south, you have plain, it's like almost a sea level. In the mid, you have hilly region. So there's an altitude of 1,000 meters or 3,000 meters, in between. And then you have the Himalayan belt, the northern sides, which it's very high. It's more than 3,000 meters and even 5,000 meters or more, Mount Everest and all those Himalayas there, So based on the altitude, you do get different kind of climate or weather there, So dengue used to be the virus or the disease in the southern plate because it's very warm out there. But comparing from 2016 to 2019 and even now, it's kind of spreading from the southern belt or the warmer area to more towards the north. So it's going to the hilly area. And also, as of now, there's been places in the Himalayan belt where they have reported dengue. So we can clearly see that within the last few years, dengue has started from the southern belt and it's climbing up and up to the mountains and even reached the Himalayan belt, and that's very concerning. And the second disease we're going to talk about is the scrub typhus. So scrub typhus, they used to talk about Tsutsugamushi Triangle, so where they used to talk about scrub typhus being the rickettsial disease found within this triangle, and Nepal used to be there. It's always there. Also India and China and parts of Australia. But now, like, you see a lot of case reports where you see scrub typhus, which are out of the Tsutsugamushi Triangle. So you have cases reported from Africa and even South America. So we can also see that the other disease, the scrub typhus, is also spreading out of this region where it used to be. So the vectors, the disease, they're moving out, they're spreading out, So this is a snapshot about the scrub typhus outbreak in Nepal. You can see that on the left side, so this is in the C, that's 2015, A and B is 2016, and D is 2017. So when it started in 2015, it was more on some of the areas on the south and maybe in the mid side. And then in 2016, when we had a major outbreak, it was all over and even to the Himalayan belt. It was moving up, And then 2017, it kind of settled somewhere in the middle, So you can see that the scrub typhus every year it was moving around, moving up, moving down, moving everywhere, And if you remember, in 2015, Nepal had a major earthquake. We had a 8.5 Richter scale earthquake, and there was a lot of damage because of that. People were displaced from their house, and a lot of people, they ended up living in a tent or in a hut or maybe somewhere near the forest, because their houses were gone. So in 2015, we have earthquake. In 2016, we have a big outbreak of scrub typhus. So I think there's something with the vector dynamics that resulted in an outbreak of scrub typhus 1 year after the earthquake. So we'll talk about that as well. So now we're going to talk in the next slide about impact of climate change and environmental changes on vector-borne disease. We're going to talk about the same two diseases here with the example from Nepal. So there's an article there's an article about climate-driven dengue fever outbreaks in Nepal. So they were kind of comparing the dengue outbreak with the change in climate. And you can see that in 2019, we had a major outbreak. And then 22, 23, we had another even bigger outbreak. So you can see that the minimum average temperature of the climate is kind of going up. So average minimum temperature in 2019 was somewhere here. 20, 21, and 22, 23, it started going up. The average temperature started going up. And so the cases have also started going up. So there is some association with increase in minimum temperature, average minimum temperature, with the outbreak of dengue. So there's some association. And also there's a global research where they were comparing effect of climate change or effect of global warming on the population of mosquitoes. And if you look at the population of the Aedes and mosquitoes, since 1960s to 2020, the global temperature is rising, it's going up, and so is the population of the mosquitoes. So as the global temperature is going up, the population of the mosquitoes overall is also increasing. And you can see that the effect of global warming. So because of global warming, the mosquitoes, they have shorter generation time, they have high population growth rate, strong temperature imposed selection would be there, and that will favor mosquitoes which can better adapt to a changing temperature. So there are mosquitoes which are better adapted to higher temperature, or even there are mosquitoes which are better adapted to a lower temperature. So they go for wide variation in the temperature. They can adapt. So there's a selection of those mosquitoes. And also with the global warming, there's increased monsoon, there's flooding, and that's breeding space for the mosquitoes, and their population will just go up and up. And in case of Nepal, the dengue is spilling into the mountains. The region, like the Kathmandu, is at the altitude of 1,400 meters above the sea level. We had a big outbreak of dengue many times here since the last few years, and also it's going to the Himalayan belt. And the reason we think is because of the prolonged and heavy monsoon rains. We have more heavy rains these days. We have rising temperature. We also have rapid urbanization, and there's a big population movement going in and out from different parts of the country, or even from abroad. So all these vectors, they are moving, or the diseases, they are moving around. And let's talk about the scrub typhus. So the reason the scrub typhus is moving around is there's global warming, and that's also selecting the vectors, or there's an increased geographic range of the vectors. There's deforestation and urbanization that is increasing the contact with the vectors. In case of Nepal, after 1 year after the earthquake, there was a major outbreak of scrub typhus. And the reason for this, we think, is because of the earthquake, people had to live somewhere near the forest, and there was increased contact with the vectors. The vectors for scrub typhus is the rodents or the rats, and the ticks over there. So I think that was one of the reasons it kind of spread it out from the forest to the human population, So these are the ways how diseases spread. So I gave you example about dengue, and I also gave you example about the scrub typhus. Now we're going to talk about the real world initiatives and projects that Nepal undertook to control this epidemic or outbreaks. So in 1997, we had the early warning and reporting system founded by the government with the help of WHO and such. And then in 2006, we had a major malaria strategic plan. So we had a proper plan for the prevention and control of malaria. And since 2006 until now, the cases of malaria has really dropped. It's less than 20, even less right now in Nepal. The indigenous malaria, it's almost eliminated. Chikungunya surveillance was done in 2013 because there were a lot of fever cases, and dengue was there, and some cases were negative for dengue, and they did the serosurveillance, and they found there were chikungunya, and that's how they identified new disease in Nepal, and that was really helpful. And as I mentioned earlier, they go with the same mosquito. The same mosquito is the vector for both the disease. In 2016, we had a major outbreak of scrub typhus, and the government, made some policies, trained the doctors, and there was a doxy campaign. So, doxycycline is the medication of choice for scrub typhus. And, doctors, they were using some other medications, amoxiclav or something else, and that was not helping. And once they made a protocol and they introduced that to the medical community, people were giving doxycycline, and that actually helped in bringing the case fatality rate lower than last year, And then there was local, district awareness, like Kasky awareness campaign, where local government took initiative in educating the community about the virus, the disease, and the vectors, And in 2019, the government formed the national guideline for dengue. In 2022, WHO did a multi-sectorial coordination campaign. In 2022, we had, US NAID doing the dengue sequencing that helped us in finding out the cause of outbreak. We also had dengue preparedness plan in 2023, and 2023 we also had vector surveillance. And so you can see that we're targeting the mosquitoes, we're targeting the virus, we're also making the guidelines, we're training the doctors, nurses, and also the locals and the local government. And it was a coordinated effort that got all these things better under control. And so the overall impact of such intervention was that the case fatality rate of dengue and even scrub typhus went down. There was improved surveillance compared to the starting years. There was better vector control, and also there was better community engagement. And that kind of helped us in tackling disease. And I think we're coming towards the end of our lecture.
Sorry,
so I'm
Dr.
more about
Dr. Prabhat, Adhikari, that please speed up. Yeah, thank you.
Yeah, so I think I only have 1 or 2 slides. So at the last, I'm going to focus about how healthcare professionals can take action. So we can just go through it. So we can work on the surveillance, so early diagnosis, surveillance, community education, and climate monitoring. We can actually work for active case management based on the guidelines. So early diagnosis, management, patient isolation, blood donation campaigns, those kind of things. We can also work on prevention. So search and destroy campaigns, applying the library sites, community education, vaccinations, and personal protection use. And at last, doctors, nurses, and the healthcare professionals, they can always work for policy formation and even the education of the community. And so we can work on enhanced surveillance, early warning system, interdisciplinary coordination, capacity building, securing the funds for research, or implementing the guidelines. So with that, I end my presentation. So I think we'll have QA sessions where you can ask me any questions or concerns. Thank you very much.
Yeah, thank you so much for that highlighting the important things and vector and things. So we will get back to you with the question and answer session. Now we are moving to the third presenter. We have Mr. Rajaram Pote. Shrestha is a National Professional Officer at World Health Organization Country Office for Nepal as part of the health system strengthening program. He is responsible for climate change, air quality, chemical safety, and other environmental health-related aspects. With engineering academic background, he completed advanced course on environment management and several other related trainings on climate change, quality or environmental management system, ISO, pollution prevention, and several other conducted by various national and international organizations. He has 3 decades of professional experience with government, non-government, and international agencies in the areas of climate and health, water, sanitation, industry, and environment in developing, implementing, monitoring, auditing, and capacity building activities. At WHO, he has been supporting the advanced initiatives towards climate resilient and sustainable low carbon health system. In line with national and global commitments, he has been actively involved in preparation and effective implementation of Health National Adaptation Plan and VAAS, NDCS, and many more. So with this extensive experience of working with WHO on this particularly environment-related and implementing, monitoring, auditing, and capacity building activities, that to present us today about the case study that about handling the vector-borne diseases and climate-related issues. So now it's over to you, Mr. Rajaram.
Thank you. Thank you very much. So at the end of her presentation, Dr. Shahanaz talked about the several measures on addressing the increased cases of the vector-borne disease in this region. At the same time, also Dr. Prabhat also mentioned about the strengthened disease surveillance. So as a case study from Nepal, I'll be talking about this climate-informed disease surveillance. So in Nepal, this initiative has already been started. So now we have been working on to advance this climate-informed disease surveillance in Nepal. So here, I will be focusing on the 2 aspects. One is the climate change, then another is the disease surveillance. And before that, I will be briefly talking about the climate change scenario of the Nepal. So many of you know that Nepal lies between India and China, with an area of approximately 147 square kilometers. And as Dr. Prabhat also mentioned that we have a very unique topography, ranging from just 17 meters from the sea level up to 8,848 meters. That is very important because of this. We are facing the different types of this climate change impacts at the 3 different ecological regions. So current population is about 3 million, and we have the annual growth rate of about 0.92%. Our main concern is about global warming and the climate change. Yes, this is also happening in Nepal. Our evidences and our records from the Department of Hydrology and Meteorology shows that there is a increase of the annual maximum temperature and is the annual mean temperature. It's about 0.056 per year, and in the winter it's about 0.02 degree per Celsius per year. So these figures are more than the global average. And more alarming thing in Nepal is that we have been facing the increased temperature rise because the high altitude elevation has the potential to increase more global warming potentiality than the other regions. So, and as a result of this climate change, yes, there are several impacts in Nepal. It is growth. There is a depletion of the water sources, droughts resulting in the malnutrition, and also there are the increased cases of the climate-induced disasters like floods and landslides. But here we have been focusing mainly on the vector-borne diseases. Yes, our two other presenters already mentioned about the prevalence of the vector-borne diseases in this region. That is equally true in Nepal as well. And I'm citing the one document from the WHO where at the end of this review of the 32 vulnerability assessment, 74 countries has mentioned that vector-borne disease is the real case. So, and in Nepal also, the first case of the dengue was detected in 2004, but gradually increased up to 54,000 in 2023. So it is quite prevalent, and it's also prevalent not only in the Tarai region, plain area, but also even in the Himalaya region, and prevalent in all 77 districts. And but the good thing is that we also have evidences with WHO support. Ministry of Health and Population recently carried out a vulnerability assessment where we focused 12 climate-sensitive disease and health risks, and out of that, 7 are very much related with vector-borne disease. In Nepal, out of several vector-borne diseases, the most cases are related with this dengue, malaria, kalajar, scrub typhus, lymphatic filariasis, and JE. Also, in Nepal, we do have many cases of the snake bites in the rabies. When we see their trends, as I already mentioned, that the dengue case has been increased significantly over the years. Malaria, they are not significant at this moment, but still, the government set a target of eliminate by 2025. It was not possible, and the revised target is the 2030. So let us hope that with the proper coordination and control, this target will be met. But still, the malaria cases is also an issue in the country. When you talk about this kalajar, scrub typhus, and snake bites, over the years, these cases has been increased in some cases, but the cases are still prevalent and still endemic in some areas. So when we talk about the relation between the climate change and the disease vectors and zoonoses, yes, definitely there are several linkages, as clearly mentioned by Dr. Shahanaz, because we know that climate change has the potential to increase the range and evidence of the vectors, and we have strong belief and understanding that because of the climate change, the vectors have been climbing the mountains because it's prevalent in all 77 districts. Because of this issue, government of Nepal has included this disease surveillance in all major policy documents related with the climate change. I will start with the National Adaptation Plan that was developed by the government of Nepal in 2021. In that National Adaptation Plan, there is a dedicated activity on the strengthening of the climate-sensitive disease surveillance system. So then, in line with the NAP and in line with the commitments that the government made at the COP26, Ministry of Health and Population prepared Health National Adaptation Plan for the period 2023 to 2030. It's a costed action plan, and in that action plan, there is also the dedicated activities on the expand and upgrade the climate-informed, climate-sensitive disease surveillance and forecasting system. And just a few weeks back, Nepal published Nationally Determined Contribution 3.0, first time in this document, health component is also addressed. And in this NDC also, there is a provision of, there is a target related with climate sensitive disease surveillance by 2030. It will be strengthened in the 134 sentinel sites. That means in all sentinel sites at this moment, and it will be expanded in the all municipalities by 2035. So there is a high level government commitment on this climate informed disease surveillance in Nepal. When we talk about the existing disease surveillance, there are definitely some issues. The first thing that there are several disease surveillance system, SORMAS, early warning system, malaria control, water quality surveillance, but in this surveillance system, the climatic data is not integrated. There is no interconnection between the weather pattern, climatic information with the disease surveillance system. And definitely there is the inadequate early warning mechanism for the emerging outbreaks. And as already mentioned that definitely at the country level, there is an inadequate technical capacity and the infrastructure to address the increased cases of the vector-borne disease. And we also know that the control of the PPD's program is quite closely related with the environmental factors, WASP factors, and several other sectors. But within the health sector and beyond the health sector, there is a limited coordination between these several sectors. And also data quality, standardization, timeliness, there are definitely some issues. Even in this picture, we can see that still we have been largely maintaining the digital data in the hard copies in the documents. And the electronization of the digitization of the process has been started, but still in many cases we're still keeping the documents and the records in the hard copies. With this background, with WHO support ministry and basically the epidemiology and disease control division, this is a dedicated division under the Department of Health Services, initiated piloting of the climate sensitive disease surveillance in 4 sentinel sites. So we know that there are 3 different ecological regions, and considering the different characteristics of these ecological regions, the piloting has been started in the Karnali Academy of Health Sciences in the mountain region, Pokhara Academy of Health Sciences in the hilly region, and in the Bharatpur Hospital and BPKHS in the Tarai region. And this tool was designed and produced by the UNICEF, UNDP, World Bank, and WHO. And there are the engagement of the several academic institutions and the several regional offices. The concept of this climate-informed EWARS, or we call it this climate-sensitive disease surveillance program, is that it links temperature, rainfall, and humidity. Basically, these are the weather and the climate parameters with the disease data. And there is a provision of the forecasting the outbreak using this climate-driven risk model. So, as I already mentioned, that definitely it is designed to predict climate-sensitive disease outbreaks, potential outbreaks, and basically the tool has been developed for the dengue, chikungunya, Zika, cholera, malaria, and most of them are definitely this vector-borne diseases. The concept is also based on this biological relationship between the climatic factors and the health data. And as I mentioned that there is a possibility of the forecasting, and as part of this EWARS Plus tool, we are developing the risk mapping after this several vector-borne diseases, and also there is a possibility of the forecasting of the potential outbreaks after these diseases. So there is a memorandum of understanding between the Department of Health Services and Department of Hydrology and Meteorology to share the health and the weather data mutually between the 2 departments. So as part of this MOU, now the Department of Hydrology and Meteorology has been sharing the weather data on a regular basis, on a weekly basis. At the same time, EDCD has been collecting the disease data from the 4 sentinel sites on the weekly basis. So in the current disease surveillance system, the government has been collecting the information on the 6 climate-sensitive diseases. They are dengue, kalazar, malaria, cholera, EG, and the SARI. And out of 6, definitely 3 are the vector-borne diseases, and that is the our contract. And as part of this implementation of EWAS Plus tool of the climate sensitive disease surveillance, we have been developing this outbreak and the probability bulletin on a weekly basis. And still at this moment, we have been validating this information and to see the effectiveness of this tool in forecasting, in analyzing the different information related with the strengthening after this existing service system. So so far, it was started in 2020, but actually the initiative in the practical sense has been started 2 years back under the leadership of the EDCD. And so there is a workshop, orientation, on-site coaching, and technical support on the regular basis to the all 4 sentinel sites. So definitely, we feel that at this moment there is a limited interdepartmental coordination, and the large health data have not been still captured because basically as part of this existing surveillance system, the data has been collected only from the inpatient, but there are still many people who visit the healthcare facilities as outpatient, and their information, their record have yet to be reflected in this climate informed disease surveillance system or mechanism. So at this moment, we have been trying to validate the outputs from this CSTS tool. Then definitely at this moment we are talking about this piloting, and definitely the next step is to institutionalize after this CHS program within the health sector, within the health system. And as I mentioned that this NDC has a target of the scaling of this CSTS in all 134 sentinel sites by 2030, and the next step is to cover the all municipality by 24. In this process, we have been working, and WHO has been supporting the government of Nepal. So at the end of this presentation, definitely in Nepal, we have the evidences to confirm that the climate change has been affecting vector-borne diseases in humans through several mechanisms. We have the several documents, and in terms of number, in terms of the geographical regions, but we know that the impacts vary from district to district. In some air, the high endemic area is the one district, and in another year, it has been changed and shifted to the another area. Because of that, definitely we need more resources and more evidence. But the main thing is also that there should be the good and a strong multi-sector collaboration between the different agencies. And definitely, as we mentioned that we already started, and there is a need to further strengthen this climate-informed disease surveillance, which has been considered by the government in several policy documents as one of the key adaptation measures. Thank you. Thank you very much.
Yeah, thank you so much for these enlightening what is happening about these dengue and zoonotic diseases with these Mr. Rajaram. Now we have a question and answer session. So we can take it up. These couple of questions. Okay. So you can see these many questions lining up that for the sessions. So we can take 3 or 4. That particularly that report to Dr. Shahanaz Chowdhury. I hope that you can see the questions. Are there any specific interventions or early warning system designed for monitoring the shift in the trends of vector-borne diseases due to climate change in Bangladesh, prompting preparedness. Any specific transmission dynamic among the vectors that has been impacted due to the climate change? Considering the time that we have only 12 minutes, that can you give it the answer maybe within 2 minutes time?
Could you please increase the size of the page? I can't see. It's very small.
Can you,
The percentage.
is it better?
So what's the, okay, yeah. The slide it. I can't, yeah. So the question is, are there any specific intervention or early systems designed for monitoring the shift in trends of vector-borne disease due to climate change in Bangladesh, prompting preparedness? No, we are still at the verge of trying to make this kind of specific intervention, but the early warning system is still not there. And that is why like the vector-borne disease like dengue, we are not yet able to prevent or control it. So specific intervention, it's not yet, but there is, I already said during my lecture that a trial is going on regarding the vaccine trial and the drug at the same time in Chittagong. So let's hope for the best that a successful result will come up and we can intervene into the community, and then we can, the incidence of the malaria can be declined. And so is for the dengue and Zika and Chikungunya. At this moment, we are not that much worried, but we are worried that it might be outbreak, maybe, but not yet at a threat, but like the malaria and dengue. But as I said, that malaria, we are trying our level best, but definitely there is no specific intervention going on at the community level. It's only the malaria vaccine, these are. So just like supportive treatments and those kinds of things are going on.
You are happy to take it up, no? Other 3 questions quickly. What traditional methods can be explored to control the rise of vector-borne diseases, such as using biological agents like larvivorous fish species?
Okay, so the traditional method, we like larvivorous fish species, like we can, to control the vector-borne disease is like, like in rural aspect, we put some oil where we have some water, stagnant water, put the oil so that the larva, this kind of biological, the vectors, they die easily because of, they can't breathe, So this kind of a traditional method, but basically there is no such, like this traditional method doesn't work anymore sometimes. So I don't think for like this kind of traditional method, the way you used to, it's really because it's been seen that the vector is now really adapting to itself. So this is not working anymore. So that's all I can say.
Yeah, with this kind of interaction, I will come back to, take it up the next 2 questions.
Okay.
Dr. Prabhat Adhikari, I hope you can see the questions.
Yeah.
There are many questions, but at least 2, it's good to know answer. How health adaptation plan of Nepal provide roadmap to tackle vector-borne disease?
Yeah, thank you very much for the question. So I don't know if that's the best example, but that's something we can do in a resource limited setting, I guess. So you can actually make those in 4 pillars. I would say one is the early surveillance and mechanisms. The second is prevention, disease management, and the third part is policy implementation. So you can divide your action in those 4 pillars, and based on the expertise of the people involved. For example, people who are more into research or who are exporting the vectors, they can take part in the surveillance system. People who work in the community, they can work in the surveillance system. Primary care doctors, providers, they can work for the disease diagnosis and the early management and then referral, right? And people who are in the policy and planning mechanism, they can work on prediction model and then logistics and implementation based on those policies. So there's not one basket for all, but I think it's a combination of different things you can do as a team, as an expert. That's all I can say, I guess. And also it depends on your.
Thank you so much. I think that most of the things then you are able to cover, and then Mr. Rajaram, I know this is the re-emergence of such disease, especially dengue, purely due to climate change, or maybe there are many other factors related to public health and behavior.
Yes, thank you. Thank you very much. It's a very, very important question. And definitely, when we see the link between this climate change scenario in Nepal and disease burden, definitely there is a close and a positive linkage between these two things. But still, there are some other factors that have been also affecting the further increased cases of dengue and other activities in the country. So because of this, I mentioned that so the research and generation of evidences, even at the district level and at the Palika level, it's very important, very crucial to establish and for also the addressing the increased cases of the vector-borne diseases. And in Nepal, we have this Health National Adaptation Plan, and it has the 5 strategic objectives, and one of them is closely related with addressing this vector-borne disease burden through the capacity building, through the generation of evidences, through the strengthening of this existing disease surveillance, and there are so many factors that has yet to be done. The process has been started, but still we need more evidences and more resources to establish the close linkage between this disease, vector-borne diseases, and the climate change. Over to you.
Okay, thank you. Let us go to again getting back to Dr. Shahanaz Chowdhury. What are the factors leading to higher dengue morbidity and mortality of dengue in males? Interesting question.
Thank you so much. Yeah, when I was going through all these research works and also I have shown the pie chart, that it was very interesting to see why there was a gender imbalance, because it seems to be like dengue is more affected, or death case is also in case of male. So I think because what I feel is that because the male person, they are more like have a outdoor activity. So because they were working in our country, they are more like people working in the agricultural sector, and all these are more having impact on, and all the boys are also going out. That is why they are having this dengue attack is more in case of male. But I think when I went through, and I would like to say in this platform that regarding this, it's very strange to see, right? So we need to have more research work, and why this kind of death and case rate is also in male, even though I'm saying that this is the outdoor activity and all. But is there anything to do with DNA or something, or affinity towards the vector is like they are adapting, right? So there is no, I mean, the male is more affected. So I think regarding this matter, I think more research should be done. And I would approach through this platform that we need international, more collaboration approach, so that there are research going on regarding these vector-borne disease. So thank you.
Yeah, I think that more data and not maybe that outdoor, and also this maybe deaths we have to immediately think about, then some health seeking and also reaction. So we will go to the fourth question. What are some of the vector-borne diseases other than mosquito-borne one, which are on rise and posing threat to human health?
Yeah, like I just discussed the 4, like the dengue, malaria, Zika, and Chikungunya, but also like Prabhat Adhikari, sir, he also talked about the typhus, the ticks-borne disease. Those are also there. So we need to be like Zika. Just I told you that Zika, Chikungunya. Zika is not yet, but maybe in future we will be in threat. Say that the typhus is in Nepal, but we are not in threat, or we are not concerned about that. But it is a high time that we acknowledge from this platform that anytime, anywhere, we are at threat. So because disease has no boundary and disease doesn't need any visa, right? So, and the mosquito also, they can fly around. Bar diagram that we were concerned during the May season, like now it's the monsoon season in Bangladesh. So it's not only had been the cases are rising, but also we have seen that in winter season also the disease is there, right? So that's why we need to be concerned that the climate, how it is impacting and how this disease is changing according to the season wise, right? So they are every time. So it's not like there will be an outbreak, but they are living and we need to be prepared regarding this matter. So like the others. So that's why I'm saying that in Nepal, you are talking about typhus, but here we never have talked about it. But so it might be the typhus is also in Bangladesh, right? So anywhere in Southeast Asia or in the world, everyone, because of this climate impact and changes of the shifting thing. So we need to be concerned about that. That is what I'm trying to say, that from this platform, that thank you for giving us the opportunity to talk about this and having such a wonderful platform, this climate change and health, because through this, maybe we are connected, we will be connected, we collaborate and work in a partnership so that at least our session today regarding the vector-borne disease, we can mitigate and reduce the incidence and prevalence rate and death rate. That is very much preventable. Thank you.
So much. Now I want to go to this Dr. Prabhat Adhikari. This is a very good question. Asking what kind of capacity building initiatives can be developed for physicians regarding vector-borne disease? It's a kind of a progressive question.
Yeah, thank you very much. So to my own experience, I think we should focus more on the One Health approach. For example, like in any, we discuss the diseases here in vector-borne diseases, you have the virus, you have the vector, and you have the host, and also you have the environment. So you need everybody, right? So we have to have a coordination, One Health approach, where the doctors who work for the humans, they also have to collaborate with the environmental scientist. They also have to collaborate with the virologist. They also have to talk with the entomologist, and different set of epidemiologists. So it's a kind of multi-party coordination. And doctors should practice based on evidence, or they should practice the guideline. And also there should be a constant feedback mechanism of doing research, finding the new things and implementing that in your policy. So I would say One Health approach, collaboration, guideline best practice, implementation, and policy formation. So I think those are the big pillars of empowerment of the physicians, I would say.
Thank you, Dr. Prabhat. And now, Sir Raja Ram, why is scrub typhus re-emerging disease in some areas?
So this is the new development in Nepal, and still this scrub typhus is not part of the existing disease surveillance system, but the government has been collecting the information. So at this moment, we don't have any study at the national level. We do have some assumptions, but it's a little bit too early to answer this question. But definitely, there are some studies and assessment at the sub-national level, but at the national level, definitely, as I mentioned, that we do not have such kind of study. So we need definitely more evidence generation and more research.
Is it a notable disease, Nepal?
Yes.
Okay, then other two questions may be related to the climate resilient health system development and the designing the tool. So the questions are, could you kindly share any additional initiatives undertaken by Nepal in building climate resilient health system? Are there any tool design and framework for that can be used to collect the climate-related data?
Yeah, definitely. There is a well-managed system to collect the climatic data from the different weather station through Department of Hydrology and Meteorology, and it is publicly available, and they publish this data in a regular basis. So there is a well-maintained system. In terms of initiatives on the building climate resilient system, yes, definitely. At this moment, we do have the policy documents. We do have this high-level commitment from the political leadership, and the big challenge is the mobilization of resources. Definitely, in many other countries, definitely we have this limitation on its financial resources, and because of that, in collaboration with UNDP, WHO has been developing a proposal for the GCF funding on this. It's called this Climate and Health Co-Investment Facility Program, and in that project, the strengthening of this climate sensitive disease services is one of the big components.
Okay, thanks so much. With considering the time factor, and then the other questions could be placed in this website or thing. So thank you so much for our attendees today, and then listening of our three eminent speakers, their presentation. And also, I would like to thank the team. That really today that with the busy schedule and then agreed to support this course that Professor Dr. Shahanaz Chowdhury and Dr. Prabhat Adhikari and Mr. Rajaram, and also this course team, and also that the Columbia University team to build up this course, and then the good initiative with the support of all our regional and global partners. So thank you so much for everybody, and then have a nice day and nice evening and good night. Thank you.
Thank you.
Thank you.
Thank you so
Thank
much.
you. Thank you very much.